So the first thing I'm going to do as I enter the room, I'm gonna wash my hands. So my name is Maria Dixie Suarez. I'm going to be the nurse practitioner working with you today. Can you tell me your full name?
Magdalene Suarez.
All right, Ms. Suarez. Do you know where you are today?
Yes, I'm at the clinic.
And what is your date of birth?
February 18, 1999.
Okay. Do you know what date it's today?
December 1st in the year 2020.
Okay, very good. Today we're going to be performing a head-to-toe assessment. I will be explaining every step as I go. Do you have any questions?
No.
Are you in any pain, any discomfort?
No.
Okay. So as I'm talking to my patient, I see that she is very clean. She's well dressed. My patient is alert and oriented, and she's in no signs of distress. She has no pain. So we are going to go ahead and examine you. Okay? Do you need to use the restroom before we start?
No.
No? Okay, so the first thing I need you to do, we're going to obtain your weight and your height. If you can come with me. Here's the scale. Okay, very good. You can have a seat. So I'm already obtaining the height, the weight, and also I just performed the Snellen chart for my patient for vision acuity, and her vision is 20/20. So I will be making sure that I provide privacy for my patient all throughout the exam and comfort. The first thing that I'm gonna do, I'm gonna take a look at your hands. Can you show me your hands? Okay, I'm inspecting for the skin. The skin looks intact. The color, very smooth. I'm checking for the nails, the hands. So the nails, no clubbing. Looks everything good, no bumps. That's fine. Thank you, Ms. Suarez. Okay, so now I'm going to be checking your vital signs. The first thing I'm gonna do is I'm gonna take your blood pressure. Is that okay with you? Okay, so the first thing, I'm going to make sure that I pick the right size, the cuff for my patient. Is it okay if I use this arm?
Yeah.
You're going to put your arm like this. Okay, very good. The blood pressure is 118 over 70. The next thing I'm going to do, I'm going to check for the radial pulse. I will be doing this for 15 seconds, and while I'm doing this, I'm also checking for the respirations approximately for 30 seconds. Ideally, I won't be telling my patient that I will be checking the respiration so I don't alter the reaction. So let me see. Thank you, Miss Suarez. So the radial pulse is 80 and the respirations are 18. Thank you. Okay, Miss Suarez, so I'm going to go ahead and proceed and check your temperature now, okay?
Okay.
I'm going to do axillary temperature. Close it. See? All right, very good. 98.4. Okay, so I'm going to check your head now. I'm going to inspect your hair, your scalp, your skull. Okay, so let me see. The hair looks very clean, very smooth. No bald spot. I'm going to palpate your head for any lumps. No lumps. The scalp also looks very clean. Okay, the head, it's normal cephalic. No lumps, no lesions, everything is very smooth. So the next thing, I'm going to be inspecting your face. I'm going to look for symmetry. The ears, the eyebrows, the eye, nose, and mouth. Everything looks symmetrical, and this is part of the cranial nerve number 7. Okay, so I'm going to palpate the temporal artery. Okay, no tenderness. Okay, it doesn't feel hard. I'm going to check now your temporomandibular joint, and I'm going to ask you to, okay, can you open your mouth and close? Okay, open again, close. Okay, no clicks. Do you feel any tenderness when you do that? No tenderness, okay. And yeah, and it looks like no limitation of movement. All right, thank you. As far as, so now I'm going to be checking for your sinuses. First, I'm going to palpate in your maxillary. Let me know if you feel any tenderness when I do this. No pain? Okay. And your frontal. Do you feel any pain?
No.
No pain?
No.
Okay, that's good. Okay, so next I'm going to be inspecting for the external ear. Okay. I'm inspecting for the skin. Okay, there are no lumps, no lesions, no redness. The ears are equal size bilaterally. There are no discharge that you could see, and the skin color is actually consistent with the facial skin color. So now I'm going to use my otoscope. I'm going to make sure that I use the largest speculum for the otoscope, and I'm going to be checking your internal ear. Is that okay? All right. So can you tilt your head? There you go. Okay. I'm checking for any redness, any discharge. I'm looking at the tympanic membrane, and it looks fairly gray. Do you feel any tenderness? No. Okay, no tenderness. Very good. Thank you. Okay, so next I'm going to be checking now for your hearing acuity. Okay, so basically what I'm gonna be doing, I'm going to occlude this ear now, and I'm gonna be whispering a few words, like short words, and you just have to repeat what I'm saying. Okay, so I'm gonna start with this ear. Is it occluded? Okay.
One. Today. Monday.
Okay, that's very good. So I'm gonna repeat the same thing with this ear.
99. 75. 22.
Okay, so that it's normal for hearing acuity. So now I'm gonna be performing the Weber and Renee test. What I'm gonna be doing, so using the tuning fork, so I'm going to do the Weber test. So you're gonna hear some vibrations. I just need you to concentrate and tell me if you can hear the sound equally in both ears, okay? You do?
I guess.
Okay,
Yeah.
let's try it again. Yes.
Yes.
Okay. So now I'm going to be performing the Renee test. Basically you're gonna tell me the same thing. You're gonna hear a vibration and you have to tell me when you no longer hear it, okay? So first I'm gonna place it here in your mastoid, and then I'm gonna just put it in front of your ear, okay? Let me try to get the hair out of the way. There you go. Okay, let's do it again.
Yeah, I know when I know.
Okay, when you no longer hear it, okay? You have to tell me it's stopped.
Listen.
Okay.
No. There's. No.
Okay, so that's checking for air bone conduction, so that it's normal. And we're gonna do the same thing with this ear now. Try to get the hair out of the way. Perfect, thank you.
No. No.
Okay, and that it's also normal. Thank you, Ms. Suarez. All right, so I'm going to check your eyes now. And let me start by asking, do you wear glasses or contact lenses?
No.
No? Okay. So at the beginning of the visit, we did a Snellen chart that was for vision acuity, checking cranial nerve number 2, the optic nerve, and your visual acuity, it's 20/20. But now I'm going to check for the near vision. So what I'm gonna do, I'm gonna ask you to cover one eye. We're gonna do one eye at a time. Okay, don't press too hard. And at a distance like this, you're gonna start reading.
Treasure trove for the one who has it all, a gift to house their most precious pieces.
That's good. Cover the other eye now, and we're gonna blink a couple of times. Cover the eye. Okay, hold it. Go ahead and read it.
For the one who has it all, a gift to house their most precious pieces.
Okay, that's good. So as we can see, my patient, she didn't adjust the magazine. She didn't move it closer or further away. So it's basically a 14/14, which is normal for the near vision. So that is good. Now to test for visual, we're gonna do the confrontation test. So I'm just gonna sit over here, basically at the same eye level. I'm gonna try to stay 2 feet away from my patient, I'm going to ask you to cover one eye. Okay? I'm going to cover the opposite eye. You're going to be looking at my eye. And then when you see my fingers, you're going to tell me now, and you're going to tell me how many fingers you see. Okay? Without moving your head.
Now, 2.
Okay?
Now, 2. Now, 2.
Okay. Cover the other eye. We're going to repeat the same process.
Now, 2. Now, 2. 2. Now, 2.
Okay, that's good. Okay, so that is fine. So now I'm just going to examine the external eye, and I'm basically just looking for the shape of your eyes. They're symmetrical, for the alignment, everything looks well. Let me see your conjunctiva. Okay, in the lower lids, they do look a pinkish normal color. The conjunctiva looks clear, the cornea, the sclera, everything looks, the eye and the inside, it looks moist. Everything looks good. And the pupils, they are round, equally round, and the color, just, well, they have brown eyes. So now using my pen light, I'm going to check for Perla. So you're gonna be looking at me. Don't move your head, okay? Okay, that's good. All right. So my patient has Perla, so pupils equally round, reacting to light and accommodation. That's fine. Now we're going to do we're gonna check the extraocular movement. So don't move your head. You're just gonna follow my pen with your vision, okay?
This is
Okay.
funny.
Okay, very good. And that was checking for cranial nerve number 3, 4, and 6. That was very good. I'm going to do an ophthalmoscopy examination. I'm going to first darken the room, and then with my right hand, I'm going to look into the patient's right eye. Okay, and what I'm doing here, I'm noticing for the orange glow of the pupil, also the red reflex of the retina, and the opacity of interrupting the red reflex. Now with my left hand, I'm gonna look into the patient's left eye, and I'm basically looking for the same thing. Okay, so that's good. So now I'm going to check your nose, and I'm just inspecting your nose first. Let me see, do you feel any tenderness?
No.
Any pain?
No.
No? Okay. So the nose looks symmetrical. While I'm using my pen light, I'm also going to take a look. Tilt your head back a little bit. Okay, everything looks well. No discharge. Everything looks fine. There's no tenderness, no swelling. Okay, while I'm using my otoscope and also with the largest spectrum, I'm going to take a look inside your nose. But first, let me see. So can you push in one of your nostrils, okay, and blow out? And that's, I'm checking for patency. Do it again. Okay, very good. Cover the other nostril. Okay, do the same thing. Blow. Perfect. That's good. All right. Now you're gonna tilt your head back slightly, and using, it may feel a little bit of discomfort. Using my otoscope, I'm going to look inside your nose. Okay.
Okay.
Ready?
Mm-hmm.
Okay. Everything looks good. All right, so that is good. Yeah, everything's fine. I don't see any masses, any swelling, no bumps. There's no discharge. Do you suffer from allergies?
No.
No allergies. Okay. So very good. While I'm checking your nose, I'm going to test for cranial nerve number 1, and this is the olfactory nerve. So I need you to close your eyes. Okay, and I'm going to give you something for you to smell. Make sure that you don't open your eyes, and you just have to identify what I'm giving you.
Okay.
All right, smell.
Cinnamon.
Okay, very good. Keep your eyes closed, and then smell this.
Coffee.
Okay, you can open your eyes now. And so cranial nerve number 1, it's intact, which is fine. All right, so next I'm going to check your mouth. Let me see. The first thing I need to do is I'm going to inspect your lips. Open your mouth. Okay, so the lips, they look moist and hydrated. They look normal pinkish color, normal pigmentation. Let me see. So I'm going to use my pen light to take a look inside of your mouth again, and also the tongue blade. Okay, so I need you to open your mouth for me. Okay, let me just inspect first. Everything looks fine. Do you feel any tenderness in your mouth? No? Okay, so I need you to stick out your tongue. Okay, move it side to side. All right, and up and down. So that is checking for cranial nerve number 12. Can you say tight?
Tight.
And light?
Light.
Okay, and I'm also observing the lingual speech. The patient can speak and she doesn't have to make any effort. She actually makes full sentences. Can you tell me again? Tight?
Tight.
Okay, that's good. Okay, and now open your mouth. I'm going to stick out your tongue one more time for me. Okay, can you say ah?
Ah.
Okay, that's good. And let me also check for the gag reflex. Open your mouth. Okay, thank you. I'm sorry. So that was checking for cranial nerve number 9 and 10, and also 12. As we can see, the patient has full range of motion in the tongue. She has no limitation of movement with the tongue. So that was checking for those 3 cranial nerves. Let me also inspect your mouth to see your teeth and your gums. Okay, open, open. Okay, very good. The patient has all of her teeth. She has well hygiene. What was your last dental exam?
2 weeks ago.
Okay, very good. It is important that you keep up with that.
Yeah.
So she has perfect teeth and no signs of swelling, no, let me see, no swelling, there's no discomfort, any discomfort in your mouth? No? Okay, very good. While I was checking that, I also checked for the uvula, and I see that it's hanging from the soft palate. It moves when the patient says ah, so that I was checking also for the pharynx. All right, thank you. All right, Ms. Suarez, so now I'm going to inspect your neck. I need you to, let me see, I'm just going to inspect and take a look at everything. The neck looks symmetrical. Let me accommodate you like this. Everything looks fine. No signs of no lesions, no masses. Can you look that way? Okay, and now this way. Okay, perfect. So there are no pulsations, no masses, no scars. Everything looks fine. For now, I'm gonna go ahead and palpate your lymph nodes. For that, I'm going to ask you to turn. Okay, perfect. Actually, just fade. Yeah, there you go. Perfect. So I'm going to be checking for the lymph nodes. I'm going to palpate. These are the preauricular. Okay, also the postauricular. Then the submandibular, submental. Okay. The anterior cervical and posterior cervical behind the mastoid. Okay. These are the deep, but you can't really feel them. And then the supraclavicular and the infraclavicular nodes. Okay, and also the occipital. All right, perfect. Thank you. So now you're going to be facing this way because I'm going to assess for, let me see, I'm going to assess for the trachea. I'm looking at the trachea that's midline. Sorry. Okay, the trachea is midline, no trachea deviation. Let me just watch you. I'm gonna ask you to get a sip of water. Okay, that's fine. Now hold it because I'm also going to be palpating for your thyroid gland. Okay, so relax and tilt your head like this. Perfect. I'm also palpating for the thyroid gland. Okay. Now take a sip of water. All right, Miss Suarez. So now I'm going to assess, I'm gonna do an assessment of your thoracic area. So basically I'm just starting with a general examination inspection. The respiratory rate, we already checked that when we did the vital signs, and the respiratory rate, it's 18 breaths per minute. It's regular. The patient, we can see that she has normal posture. She doesn't need she makes full sentences. She's not distressed. It's not using any accessory muscles to breathe. And there are no signs of cyanosis, no clubbing. So everything seems within normal ranges. Okay, so now I'm going to do an inspection. Let me see. You're going to sit like that because I'm going to check for lower chest expansion. Okay, I need you to take the hair out of the way. Perfect. As you can see. Okay. So hold on. Just try to relax. And I'm checking here for the lower chest expansion. Okay. Go ahead and breathe. Breathe. Okay, full breathing, deep breathing, very good. Okay, and that's very good. I'm also checking for tactile fremitus, and I'm looking for the symmetry. So I'm going to ask you to say 99, okay? Go ahead.
99. Again? 99. 99. 99.
Okay, that's good. Now I'm going to percuss, and I'm comparing each side. Okay, that's good. So upon percussion, the lungs are clear, resonant, and I'm going to go ahead and auscultate the lungs. You're going to take a deep breath in when I tell you, okay? And I'll be also comparing each side. Using the diaphragm of my stethoscope, I'm going to start the auscultating the lung sounds. Breathe. Let go. Breathe. Make sure you let it out through your mouth. Okay, very good. The patient has normal breath sounds and no adventition sounds are heard upon auscultation. All right, Miss Suarez, so now I'm going to be checking for your breast, and what I'm gonna be doing, I'm going to be inspecting for symmetry, the shape, of course the contour, the skin, for any discoloration, any scar. So the first thing that I need you to do for me, I need you to raise your arms above your head like that, okay? And I'm looking for the movement, the mobility, no, any signs of dimpling. And now put your hands on your hips, okay? And do this for me. Okay, perfect. Thank you. All right, Ms. Suarez. So now I'm going to do a cardiac examination and I'm going to inspect for your chest. The first thing I'm gonna do now, I'm going to palpate the carotid artery. Okay, I'm gonna go one at a time. Very good. Okay, and they are both equal. So now I'm going to auscultate for any bruits or murmurs, and I'm gonna be using the bell of my stethoscope. Okay. So no bruits and no murmurs are heard. So very good. I'm gonna proceed now and do a tactile parameters of the anterior chest. So just facing me, perfect. So we're gonna do the same thing. You're gonna repeat. You're gonna say 99 when I tell you. So okay, go ahead.
99, 99, 99, 99.
Okay, very good. And that was for looking for symmetry of the tactile parameters. I'm going to palpate. I'm gonna localize your apical pulse first. Okay. And this is in the 5th intercostal space. I can feel it. Let me go ahead and auscultate. Very good. So I'm going to do a cardiac auscultation now. Started in the right second intercostal space. Take a deep breath. Okay, that's very good. Thank you. Now I'm gonna ask you to lay down flat for me. And I'm going to inspect your abdomen. So I need you to put your arms on the sides. Okay, very good. I'm going to always make sure that I'm providing privacy for my patient. So let me raise this. And the first thing that I'm doing while looking at the abdomen, I'm going to inspect for, I'm going to notice the shape, the symmetry. Of course, I'm looking for any swelling, any distension of the abdomen, any pulsations or discolorations. In this case, my patient has no discolorations, no excessive growth hair, no abnormal findings. So the first thing after inspection that I'm gonna do, I'm gonna follow up with auscultation for abdominal sounds. As you can see, I started by auscultating the right lower quadrant. And yes, the vowel sounds are present in all of the quadrants. And now I'm going to go ahead and auscultate for the aorta and also the renal arteries. Okay, very good. So the next step, I'm going to percuss, and especially focusing on the liver and the spleen. Okay. So you can hear the dullness of the liver. You can hear the dullness of the liver and the spleen, and also notice the tympanic sound of the stomach, the air-filled spaces. Now I'm going to do some light palpation. It may feel a little uncomfortable. Just let me know if you feel any discomfort or pain, okay?
Okay.
Any pain?
No.
Okay. So now I'm going to proceed with the deep palpation. It may get a little uncomfortable. Just let me know if you feel any discomfort, any pain. Any pain?
No.
Any pain?
No.
Pain?
No.
Any pain?
No.
Okay. Let me try to palpate the liver. No pain?
No, it just
Okay.
tickles.
Okay, very good. So to continue, I'm going to check for 3 signs. If they are positive, it's an indicator of appendicitis. So the first one that I'm going to do is the Robson sign, and I'm going to palpate firmly on the left lower quadrant. If it's positive, the patient should feel pain on the right lower quadrant. Any pain?
No.
Okay, that's good. So now I'm gonna do the saw sign, and with this, I'm going to be on the right knee. I'm gonna place my hand, and you're going to try to elevate your thigh. Any pain in your right lower quadrant?
No.
Try it again. Elevate it. Okay. No pain?
No.
Okay. And now we're gonna do the obturator sign. So try to go on your left side. There you go, like this, and okay. Let me know if you feel any pain.
Okay.
Any pain?
No.
Okay, that's negative. Okay, one more thing. I'm going to also check for the Morphus sign, and this is an indicator of any gallbladder inflammation and gallbladder inflammation, and possible to liver inflammation. So you're going to tell me also if you feel any pain, okay? Take a deep breath. Any pain? Okay, I'm gonna try this again. Take a deep breath. Any pain?
No.
Okay, all right, that's very good. And now I'm going to palpate for the kidney, okay? The right kidney, it's a little bit palpable. And now the left. Okay. Thank you. So you can sit up now. Now I'm going to be checking your musculoskeletal system. So the first thing that I'm going to do is the inspection of the hands. We already did that at the beginning, so I know there are no signs of deformities or any enlargement of the hands. So now I'm going to ask you to perform some exercises for me so that we can check some upper extremity range of motion. So with your arms like this, put it like this, and then like that, up. Okay, perfect. Now with this, we're checking flexion and extension. Now bring your arms like this, down, okay, up to the side, down, okay, and now over your head, behind your head. Okay, that's very good. Put your arms down now. All right, so I'm going to be checking next for some signs that in the case of positive, they will be indicative of carpal tunnel syndrome. So the first one that I'm gonna do is the Tinel sign. So bring your arm like this, and what I'm basically doing here is I will be tapping, and you have to let me know if you feel any discomfort, any signs of paresthesias, if you feel any tingling in your fingers. Okay. Any tingling?
No.
Okay.
Feels good. No.
And you are supposed to go all the way up. No? Okay, perfect. So next we're going to do the Phelan's syndrome sign. I'm sorry. And you're gonna bring your arm like this. Okay, like this, hanging. Okay, together, perfect. And I'm going to ask the patient to keep that position for about a minute, and the patient should be able to do it without any discomfort, any pain. If there's any pain, then it will be an indicative of carpal tunnel syndrome. You can place your arms now down. Okay, and lastly, I'm gonna do the carpal compress sign, also indicative if positive of carpal tunnel syndrome. And I'm gonna ask you to, let me see your arm, okay? And I will be putting pressure basically in the median nerve. Okay, bring your arm like this, like this, okay? Perfect. Do you feel any sensation, any discomfort, any pain? The patient should be able to hold that for about a minute as well, 40 to 60 seconds without feeling any pain. Okay, so now I'm going to also assess for any pain in the shoulders. Do you have any discomfort, any pain? No? Okay.
No.
So I'm going to proceed doing some signs that will be indicated of if there's are any problems with the shoulders. The first one that I'm gonna do, it's known as the empty can test. So basically you're gonna bring your arms like this with your thumbs facing the floor, okay? And I'm going to do some pressure, and you kind of wanna resist the pressure. And the test will be negative if the patient is able to resist the pressure. So push, okay, very good. Bring your arms down, thank you. Next, I'm going to do the nearest test, and with this, it's also checking for the shoulder. So facing this way, I'm going to put some pressure right here, and with the arm, same thing, the thumb facing, there you go. Okay, I'm gonna bring the arm. Do you feel any pressure, any discomfort, any pain while I do this?
No.
Okay, so it's negative as well. Okay, next I'm going to check for the spinal, and I'm gonna ask you first to check for the range of motion. So I need you to move your head in this motion, up and down, side to side, side to side. Okay, can you bring your ear to your shoulder? Okay, the other side, perfect. Well, we're done. Perfect, thank you. So I noticed that you have full range of motion, and when we're doing this, I'm also checking for cranial nerve number 11. So I'm gonna ask you to shrug your shoulders, but against my pressure. Hold on, let's try. Okay, perfect. And you're going to move your head against my pressure as well. Okay, to the other side. Okay, thank you. Now I'm going to take a look at your spinal. So I need you to turn that way. Perfect. Let's get the hair out of the way. And I'm just basically looking for and assessing, palpating for your spinal. Okay, can you bring your body towards the front a little bit? Towards the front, okay. Better. Okay, that's very good. All right, so now I'm going to inspect for your knees. Let me take a look. I'm just looking for any signs of deformities, any bulgings. Well, no bulgings, no deformity. Let me see. Okay. So I'm gonna ask you because I'm gonna test for some lower extremity range of motion. So I'm gonna ask my patient to lay down flat. Okay. Perfect. And while you're doing this, I'm going to see if you can bend your knee. Okay, that's good. Bring your leg out. Okay, lift your leg. Okay, okay, down, perfect. Let me see this knee and I'm going to compare bilaterally. Okay, can you lift it up? Okay, okay, perfect. Do you feel any discomfort in your hips? No? Okay, let's put the arms on the side. Very good. And now with your feet, you're gonna do some flexion and extension, rotation. Okay, my patient has full range of motion also in the lower extremity. So while we're doing this, I'm also checking for the thumb test, and this is for the hips to see if there are any pain or discomfort with the hip. Of course, you cannot do this test on patients that have a hip replacement because it will cause a dislocation. So I need you to bring your knee, put your arms like this, bring your knee, okay, towards your body. Do you feel any discomfort? No? Okay, so you can bring it down. Perfect. Okay, so also checking for the knees, I'm gonna do the development test now, and basically I'm stroking down my hand, and then I'm gonna put pressure here and up, pressure, and this is to check for the patellar. Okay, any discomfort?
No.
Okay, that is a development negative test. Okay, next I'm gonna do the McMurray. I'm gonna bring your knee like this, okay? And down, again, you basically wanna do this a couple of times. Any discomfort?
No.
Okay, just keep your arms here, thank you. Okay, so while checking for the knees, I'm going to do the anterior cruciate sign. So bring your leg like this, and I'm gonna say that your feet, okay. Okay. Lastly, I'm gonna ask my patient to lay on her stomach because I'm gonna do the athlete grind test. Okay. Thank you. And we'll bring in your knee like this. Okay. And this is basically to check for rotation, any lateral, extreme lateral rotation. Okay. That's fine. Okay, so you can have a seat now. Okay, Miss Suarez, so now we're missing some of the cranial nerves. I only want to make sure that in order to check cranial nerve number 5, I'm going to ask you to clench your teeth. Again, one more time. Perfect. Okay, now we are going to check cranial nerve number 7, which we already did at the beginning of the examination, but I just want to make sure that I get some of the sensory part also. Okay, so I'm gonna ask you to frown. Okay, puff out your cheeks. Okay, smile. Okay, very good. Now I need you to close your eyes and you're going to tell me when you feel the sensation, okay? Just tell me now.
No. 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 No.
Okay, very good. So now I have to check for motor, gait, and the coordination. So I'm gonna ask you to do this exercise and you're gonna go faster as I tell you.
Okay.
So go ahead and start. Faster. 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 Very good, thank you. Okay, so now I'm going to check for prephastesia. So let me see your hand and look in the other way. You're going to tell me the number that I'm drawing in your hand.
1,
Okay,
2, 5.
okay, very good. And now I need you to close your eyes because I'm going to check for osteoporosis. Okay, extend your arm. Okay, I'm gonna put something in your hand and you have to tell me what it is.
Controller.
Okay, very good. You can open your eyes now. Okay. All right, so now I'm going to check your gait. So I just need you to walk across the room.
Like straight there?
Yep. Okay, and now the other way. Perfect. Now we're going to perform the lumbar test. So I need you to stand here, and for this, you're just going to stand like this. They're close together, your feet. Okay, there you go. And you're just going to stay like that for a minute. And what I'm looking for is that my patient doesn't lose her balance. That's the first part of the test, and after that, I'm gonna ask her to close. Actually, you can put, there you go, you can face it like that, perfect. I'm gonna ask you to close your eyes, and I'm also going to make sure that my patient doesn't lose her balance. You can open your eyes now, and you can have a seat. All right, Ms. Suarez, so now I'm just going to check for your tendon reflexes. I'm going to be checking for the brachial, the tricep, and the patellar. So I'm gonna ask you to bring your arm like this. Okay, put it like this. Okay, that's very good. I'm gonna check for the and then just try to lay back a little bit, okay? And having your leg angling like this. Okay, thank you. Now I'm gonna ask you to lay flat here, lay down.
That way?
No, that way. And I'm basically just checking for any signs in your extremity. I'm checking for the temperature, any signs of edema. I don't see any edema, any deformities. Everything looks symmetrical. The temperature, it's okay. Everything, it's not warm, it's fine. Warm to the touch. Okay, no signs of edema. And I'm also checking for the dorsalis pedis in both, and also the posterior tibia. Okay, can you sit up? And that is the end of the head to toe examination. Thank you so much. And do you have any questions?
No.
Okay, thank you.
Thank you.